Today, I'm going to be administering subcutaneous regular insulin. The first check consists of checking the physician order against the MAR. We have to check for name of the patient, medication name, dosage, route of administration, time of administration, and we have to do the right documentation and any allergies that our patient might have. The second check consists of checking the patient's name, the name of the medication against the MAR. We have to make sure we are at the right time, we have the right route of administration, and we check for the expiration date on our bottle. We check any drug allergies that our patient may have and any documentation. At the second check, we also prepare the medicine for patient administration. Once we have made sure oral checks are right, we're ready to prepare the medicine for medicine administration. Since we have insulin, we don't shake the insulin, we only gently roll the insulin. Then with an alcohol wipe, we clean the top of our bottle. We make sure we have the right syringe. We draw 56 units of air into our syringe. We insert off syringe into the bottle and we pour air into air. Then now we're ready to draw 56 units of insulin, since that's what the MAR says. Recap our syringe, and we're ready to do patient administration.
Come in.
Good morning, Miss Jane. My name is Andrea and I'm your nursing student. I'm gonna place my syringe and my alcohol pad in your bedside table. Can you tell me your name and date of birth, please?
Jane Doe, May 26, 2006.
Thank you. At this time, we are ready to do the third check that it's always done by the bedside of the patient. Like we already check for 2 ways to identify our patient, that they were name and date of birth. We also have to make sure we have the right name of the medication, the right dosage, the route of administration, the right time. Right now it's 8:30 in the morning, and like we can see, we can administer our medication because it's due at 8 in the morning. And finally, we have to make sure our documentation is right and that the patient has no allergies to the drug that we're ready to administer. Now that our third check is done, we're ready to administer the insulin. Miss Jane, I'm gonna be uncovering the back of your arm since you administer yourself insulin into your belly and your legs all the time. And I don't want you to get any more bruises or marks on those areas. So I'm gonna be using the back of your arm. Is that okay with you?
Yes.
Okay. I have to make sure I clean the area with an alcohol pad. And I pinch around 1.5 inches of skin. All right, Miss Jane. Now I'm gonna dispose my syringe in one of the biohazard red buckets that are always in the patient's room. All right, Miss Jane, we're all finished in here. Is there anything else you need from me?
No, thank you.
Okay, if you need anything, let me know. To be finished with the med administration of insulin, we have to document on the MAR that the insulin was given and the time that the insulin was given. We also have to write the site of insulin administration. In this case, since the patients usually always use their belly or the legs, I use the back side of her arm to administer the insulin.